We are live.
Ian, I have one thing before we get started. How do you get the chat up so I can see what's going on?
Participants, click participants, and that'll open up.
Bingo. Okay. And I will be able to see them here if they raise their hand.
Yes.
Okay. Are we ready to get going?
Yes, we are live.
And the attendees are unmuted?
No.
No, I'm sorry. They can hear me though, right?
They can hear you. Everyone can hear you. And they're on.
Sorry, everyone. I know this is new, so we're just working through and making sure it's working correctly. So welcome to the first virtual healthcare leadership press conference. Thank you all for joining us. This is going to follow our previous format pretty closely, in that we're going to have an initial presentation from healthcare leadership before we open it up to a Q&A. So the way the Q&A is going to work is you're all currently muted. If you have a question, just raise your hand, and I will go through those hands and call on you, and you will be unmuted with the help of CTV. And then we will remute you for the answer. If you have a follow-up, just raise your hand again, and we'll try to pick you up there. If you have any technical difficulties, just text me. This is also being simulcast live on the county's Facebook page at facebook.com/County of Santa Cruz, as well as I think CTV's YouTube page. So with that, I think we're ready to get started. I will turn it over to Dr. Newell. If she's ready, feel free to proceed.
Good afternoon, everybody, and happy Friday to you. We're headed into a long weekend, so I hope that you get some rest and get ready for the next phase of the roller coaster ride, as I like to refer to this COVID pandemic in the county of Santa Cruz. It's been a while since we briefed the press and the community in this manner, so forgive me if I repeat some things that may seem like old news to some of you, but I want to make sure that everyone knows that we have a data dashboard for Santa Cruz County Health Services Agency, specifically around public health, and that's at santacruzhealth.org. And you can find the latest COVID information there, including resources, many resources for vaccination. If you've been following the data dashboard, you saw that in the last 2 weeks, we have crossed two numerary thresholds. We crossed the 10,000 reported known cases of COVID-19 in our county, and in fact are well into the 11,000 range now, with 11,447 cases reported as of yesterday afternoon. In addition, we crossed the threshold of having 100 deaths from COVID-19 in our county, and we're now at 111 with a number of death certificates pending that will add to that number. 337 of our county residents have required hospitalization for COVID-19. We have also crossed the mark of 100,000 lab results. And our lab testing capacity now is excellent. We are hoping that no one has trouble getting testing whenever they want to be tested. Plenty of free testing available through our state sites at Ramsey Park and the newest site at Santa Cruz Civic Auditorium in downtown Santa Cruz. And there's lots of other testing sites available as well, including through your usual healthcare system. Our surge continues that started with Halloween. So we knew that the back-to-back holidays of Halloween, Thanksgiving, Christmas, New Year's, all the other many celebrations that happen during those months were going to take a toll on our community. And they perhaps have hit Santa Cruz County harder than they have the rest of the state. Those of you who have followed us know that our skilled nursing facilities have all been involved significantly with outbreaks at this point. Not that they're current, but at least during this holiday season. And we have many outbreaks in our community with 125 open exposure events reported to us at this time. Those are outbreaks that have at least one case and usually multiple cases involved in settings such as grocery stores, retail, manufacturing, agricultural, nonprofits, construction, banks, car dealers, gas stations, restaurants, coffee shops, medical buildings, hospitals, a fire department, and many of our congregate living facilities, including our jail. And that's just a partial list. 19 of them are confirmed ongoing outbreaks, and we are focusing on the higher risk residential facilities where folks live together in close quarters and are at higher risk for that reason. So the latest data, if you're following the blueprint tiers, I know we're no longer really paying much attention since we're well out of the yellow, orange, red, and purple zone and deep into purple at this time. But the data is still pertinent and is updated weekly. And the data that came in this week surprised even me with its severity. It's higher than we've ever seen, with a case rate of 59.0 COVID-19 cases per day per 100,000 residents, and a positivity rate of 12.3%, with our health equity quartile reporting a positivity rate of 22.7%. Some of our safety net clinics are reporting consistently, day after day, a 40% positivity rate among the people that they're testing. So very worrisome. We are seeing a little bit of a plateau in our hospitals and our ICUs right now. We believe that that's because we're between the Thanksgiving and Christmas surge in terms of hospital effects. So at this time, I've made a decision to lift my suspension of elective surgeries, at least for the coming week. And we will be watching closely what happens over the next 10 days to 2 weeks. I met with state leadership this morning, including the data team at California Department of Public Health. And they have given me a little bit of reassuring news that the Bay Area is not expected to reach 0% ICU capacity in the next 4 weeks. So even with the stressors expected in the coming weeks on our hospitals, that the Bay Area overall is continued hopeful to manage that and not hit a 0% ICU capacity, which means that we should be able to rely at least a bit on our neighboring counties to help us with our ICU load. With that, I think I'm going to turn it over to Dr. Ghilarducci to give you a little bit more information.
Thank you, Dr. Newell. Yeah, I'll be talking about vaccines, and we've had naturally a lot of questions about vaccines this week in particular, and so we'll spend a little bit of time on this. We'll start off with some of the news this week. As you know, Governor Newsom had announced that the state is prioritizing those individuals 65 and older to receive vaccine as demand subsidizes amongst the healthcare workers, which we call the phase 1A group. So these individuals have been moved to the front of phase 1B. That's about 48,000 people in Santa Cruz County. The governor also said and reiterated that phase 1A remains the priority. So these are healthcare workers, long-term care residents. They remain the highest priority to get vaccines. And so our efforts right now are currently focused on finishing up the phase 1A group. There's some problems with that, which I'll get to in a moment. But the main issue is the vaccine really remains in limited supply. Santa Cruz County's current inventory is dedicated to healthcare worker immunization, and we're doing clinics this week. The other thing is vaccines do come to us through many different avenues, not just through the health department. And so most people will actually get their vaccination through their primary care providers. That's going to be a very important part of vaccinating our community. So for those of you who have primary care providers, we urge you to reach out to them to find out when you may be eligible to receive vaccine. But I will say this, is that the county is really committed to getting all of our vaccine out the door and allocated to the community within 10 days. What limited stocks we have on hand have been encumbered or already destined for first dose and second doses. We have very little storage that we keep in our freezer. So that is a focus. So a little bit about availability, and let's just talk about what we call the four-legged stool. It comes to us through 4 different mechanisms. One is the federal pharmacy program, which is oriented toward our skilled nursing facilities and our residential care facilities. And I'm happy to report that all of our skilled nursing facilities have received a first dose or will get their first dose by the end of this week through the federal pharmacy program. To be honest, I wish it had been faster. This is a very high risk group. This is where most of our deaths are coming from, but it is happening. Unfortunately, for the residential care facilities, they are still waiting to hear when they're going to get their first dose. So this is an area we're watching closely, and we view this as a high priority area, and we're hoping that the FPP does come through for that. The other source are multi-county entities, which are, essentially large healthcare organizations that have a footprint in many different counties. So this would be Kaiser, Sutter, Dignity is the big 3 in our area. And so they get independent distributions that go directly to them and not through the health department. Many of the vaccines that you're getting through that avenue are the ones that, for those of you who belong there, are going to be getting it through that avenue. The smaller healthcare providers have enrolled in a system called CalVax, which is actually kind of brand new as of yesterday or 2 days ago. They've enrolled in that system and will be getting vaccine directly. That includes providers such as Safeway pharmacies, as well as many other providers in the county, doctors on duty, for example. And then as finally, the allocation that comes to us, the local health jurisdiction, is the 4th leg of that 4-legged stool. And so we get, I think, a relatively minor amount that comes through that avenue. That vaccine is really going to be dedicated to those who don't have ready access to healthcare. We obviously have a high priority on focusing on those that have had a disproportionate impact or inequitable impact on this as a result of COVID. So we'll be focusing our efforts in those communities for sure. That said, many of you are asking, when do we start phase 1A? We're still trying to finish, start phase 1B. We're still trying to finish phase 1A, and I'll just give you some numbers that sort of demonstrate this. As of now, we've received a little over 16,000 doses. To finish phase 1A, we need 29,000 doses. Next week, we are getting 200 doses sent to us. So the amount of vaccine that's been promised is not really coming through, and that really makes this an impossible task to add in phase 1B at this point. The vaccine's been distributed to various providers. We're happy to provide those numbers to you independently, but basically a total of about 5,600 doses have been allocated to different providers through the county. And our current inventory right now is, and this is due to a very recent shipment, is about 11,000 doses. And these are going right out the door very soon to all of these providers. The time is coming up for second doses. And then we have some other phase 1A priorities that we're working on. So, this really just illustrates kind of four problems that we've seen that have really come up this week. Vaccine supply I've talked about. We have other issues with our data system that is supposed to register immunizations in the state is not really working properly. We're not able to get data out of that. So understanding how many vaccines have actually been administered is a difficult chore without that. Adding the phase 1B, very important group, the 65 plus, we agree this group needs to be vaccinated as soon as possible. But adding that in at the last minute has really upset our careful 2 months of planning and has really created, I think, some unrealistic expectations on the part of the public, not unrealistic for the public to have the expectations, but expectations that we can't fulfill because, as I just pointed out, we don't have the vaccine to do it yet, but they are going to remain a high priority, as well as the traditional 1B group, like all the people that answer 911 calls, the other critical infrastructure groups that are all dedicated to keep our society functioning. Those also remain a high priority. And then I will say also that all of this has come in the wake of no state or federal support. This has been laid on local jurisdictions, which are typically just thinly staffed. And so this is a difficult task that relies on volunteers like Dominican Hospital, for example, who has deployed many volunteers to help us vaccinate individuals outside of their facility. And we really tip our hat to them, as well as to Watsonville and now Sutter Hospital, which is Sutter Maternity and Surgery Center, which is also helping us with this monumental task. We do expect our inventory to increase. We don't know what that's going to be. That's one of the planning problems we have. We do have some max vaccination clinics that are being planned once that supply comes on. We're going to be focusing initially on South County for the equity reasons that I mentioned before. But I think the bottom line is that we are asking for patience and understanding, and we certainly understand your anxiety, and we're actually very happy that many of you are interested in being vaccinated because that is really our path out of this. So we'll take questions at the end, but thank you. I'll pass it off to, let's see, this is going to be Mimi, who's going to talk about the stay-at-home order.
Hi, Dr. Ghilardici. I'm actually going to talk about a few other things besides the stay-at-home order. As Dr. Ghilardici mentioned, we have received 16,725 doses in Santa Cruz County so far, and I wanted the public to understand how that happens. So we've only been made 2 allocations of vaccine. An allocation does not mean what we've ordered. It also doesn't mean what we've received. So our first allocation of 7,800 doses was sent, which we ordered all of, was sent to us in small shipments at a time, in dribs and drabs. And so when people ask the question, why didn't you get all of those out? We can plan as far ahead as we know that we will receive vaccine. Luckily, as Dr. Ghilardici mentioned, on January 12th, the evening of January 12th, we received almost 9,000 doses, which account for the 11,000 or so that we have on hand. And again, we will commit to getting, when we receive doses, we'll commit to getting those out within 10 days. So how are we going to get those out? As was mentioned before, there are 4 ways for vaccine to be sent out to local jurisdictions. And those include those health systems that work in multiple counties, the federal pharmacy program, and now individual practices and groups and pharmacies through the CalVax program. So as a local health jurisdiction, we really only have control and oversight over the vaccine that's allocated to us. So many of you want to know numbers, and you want to know numbers on a daily basis. And the difficult thing is, while we know what we have in our own allocation and what we've distributed, we don't always have really good data on any of the other lanes of vaccine distribution. And with CalVax being so new, it's unclear if we'll have information about that lane. So we are working as local health jurisdictions to coordinate with the state, because the state knows what they've sent all of us in all of these 4 different legs of the stool. So please be patient with understanding how much we have and when it's going to be. But the main message is at this time, we don't even have enough in our county allocations to hit all of phase A. We're looking for phase 1A. We're looking forward to that additional 12,000 plus doses to finish off that phase. So in terms of how are all of the county partners working together to get these vaccines in people's arms and to get them in the right arms at the right time, there is a really wonderful partnership of healthcare system partners, clinic partners, nonprofits, all working together with our Health Improvement Partnership Council. And there are a lot of plans in place with the partnership of all of these folks for a multitude of clinics. So our hospitals have already helped providing phase 1A vaccine. And today there is a phase 1A mass vaccination clinic that's being sponsored and hosted by Sutter PAMP, but participation with a lot of partners. And we also have plans. Those may continue. The intent is to continue them to exhaust the vaccine on hand. And then we also are planning in partnership with Salud para la Gente and also with guidance from Sutter and the county EOC and a lot of other partners, South County clinics that we hope will launch in early February. And as was mentioned before, completely dependent on the receipt of vaccine. A lot of people have asking, do we support opening up vaccine to over 65 populations? We absolutely support that. When we're able to do that, we will do it. However, we do know that other counties have been doing things differently, and health systems sometimes in other areas have more accessibility to vaccine than we do here locally. So it could be that other counties will move at a speed more quickly than us, but here we're really, really focused on getting to phase 1A as soon as we can before we move into phase 1B. Some people ask us why that's holding on to vaccine. Dr. Newell had mentioned how our hospital systems are overwhelmed. We have been locally at 0% ICU capacity since Thanksgiving. That is highly, highly concerning. So one of the first goals of giving out vaccine is to work at the highest risk and the highest stress on our systems first, and those are our hospitals. So if we can get vaccine first into the people who staff our hospitals and work our hospitals, and then second into those populations most likely to get sick and need hospitalization or die of COVID, that will help with the most immediate aspects of emergency response. So that's why we're still trying to finish phase 1A before we start phase 1B. In terms of dashboard information, we will work with our local partners to find a way to at least provide our local information on that dashboard. And as far as the stay-at-home order that Dr. Ghilarducci mentioned, in a statement issued by the California Department of Public Health, the state has extended its regional stay-at-home order for the Bay Area. And it was originally set to expire on January 8th, but the region's ICU capacity needs to exceed 15%. There are places that people can go now on the state websites to get a lot more information about the state's vaccination plan. And we locally will follow the state guidance for our vaccine planning in terms of which groups are going to be receiving it when. And as you all know, that can change on an almost daily basis because just this week we had a new group over 65 added to phase 1B. So I encourage you to go to covid19.ca.gov/vaccines. And if there are any updates from the state or any changes on phases and tiers, that's the place to go. How can the community help? There are a lot of ways that you can help. I know that everyone is clamoring a vaccine and we're all saying that the vaccine is the light at the end of the tunnel, but it's not as if we get to the end of the tunnel and we all get vaccine and it's over. So I want to close with a few statements about safety. First of all, when all of you are able to get the vaccine, and I hope that all of you choose to do so, you don't have immediate protection from the vaccine. When you get your first dose of Pfizer or Moderna, it's going to take some time, maybe 10 to 12 days to start for your body to start becoming immune and producing immunity. And then depending on what you get, 21 days or 28 days later, you're going to get your second dose. You will get about 50% protection, 10 to 12 days after your first dose. So you could still be susceptible to COVID and you could still be an asymptomatic carrier of COVID. So it's really, really important for our entire community to be careful even after they've gotten their first dose of vaccine and then a few days after their second dose. After that second dose, the protection level is much, much higher in the mid 90%. So this is why it's so important that before you get your vaccine, you continue to stay at home, wear a mask, wash your hands, do not interact with folks outside of your household if you absolutely don't need to. And especially when you do get the vaccine, remember the time frame of protection because you're not immediately protected. I think the closing thought that I will end with is that this is a worldwide event. It affects whole populations. So we just implore everyone to be patient, be kind, do your part. And if all you can do right now is stay home or wear a mask, wonderful. One thing I forgot to mention is the new strains. So there are new strains and they have been found in California. And the B117 strain is one of those strains that has been found in a number of states in the US. It was originally found in the UK. And it is a lot more infectious than the strains that we have been experiencing so far. And our intelligence from the CDC is that they expect that that strain will be the predominant strain in the United States by March. So with the vaccine numbers that we have right now, it's clear we won't be able to vaccinate all of our populations by March. So again, even more important to just stick with us a little bit longer and wear the mask, wash your hands, stay at home. Thanks. And I think I'll turn it over to Jason Hoppin for any questions.
All right, thank you, Director Hall. We will move to the Q&A portion. It looks like a couple of you have figured out how to raise your hand. For those of you that need help, it's just click the participant button. You should get a window on the right-hand side with two tabs, panelists and attendees. You'll be under attendees. Everybody's got it now. Scroll to the bottom and raise your hand. So I think Kara Guzman was the first one with her hand up from Santa Cruz Local. So let's try to go to Kara.
Hi, can you hear me?
We can. Thank you, Kara.
Thank you. Dr. Ghilarducci, you predicted earlier this month that the phase 1B group would perhaps receive the vaccine in February. Is that still your prediction, given the governor's addition of 65 and older people to that group?
Yeah, thank you, Kara. Yeah, we've been talking late January, early February for some time. That was all before this announcement this week. It really depends on vaccine supply, but we're committed to getting into phase 1B as fast as we can. We gotta finish up phase 1A, as Director Hall mentioned. This is a critical population that needs protection. But if we get vaccine coming in as has been promised that we'll get, and if it actually shows up, then we'll be moving very quickly into phase 1B, probably much earlier than February.
Thank you. Our next question will come from Josh Cristianto. Josh, if you can go ahead and ask your question.
There we go. Hi, it's Josh from KION. I do have a quick question about how many people have gotten shot in Santa Cruz County so far, you know?
I'll take that one. So what we know, and again, our data is not complete because it's given by different people, but we believe about 5,600 injections have been done so far. It's probably higher than that. There's vaccine clinics happening right now. But as I mentioned before, the state data system is not reporting properly. And so we're not getting clean data from that. Once that gets fixed, we'll be able to give you better numbers, but roughly around 6,000 at this point.
So just to clarify, Dr. Ghilarducci, that would be people vaccinated from the public health allocation, the one leg of the four legs.
Yeah, no, actually the 5,600 refers to a combination of all providers. So Dominican, Watsonville, Sutter, Santa Cruz Community Health Centers, et cetera.
Right, thank you.
Salud, yeah.
Our next question will come from Mallory Pickett from Lookout Local.
Hi. I have several vaccine questions that we can get to later, but I kind of wanted to start with what Dr. Newell mentioned about the holiday surge hitting Santa Cruz County maybe harder than other places in the state. I was curious, like what makes you say that, and is there any idea why the numbers are so bad here?
Well, I think the surge just hit us later than it did many other counties. Our community was so good for so long about following all of the social distancing requirements, really wanting to do the best for our friends and neighbors and loved ones. And so we were able to hold off many of the outbreaks that other counties had sooner, for example, in our skilled nursing facilities. So on top of the holiday impact, we also had outbreaks, many outbreaks in our residential care facilities that really impacted our case rate as well as our hospitalizations and death rate. So I don't think it's that we were necessarily hit harder than any other county, but it all just came at once during the holiday season.
Great, thank you. Our next question is from Jessica York at the Santa Cruz Sentinel. Hi, Jessica.
Hi, I was just wondering if you could possibly speak a little bit about the plan, if there is one already in the works for people who can't easily come to get the vaccine. Perhaps they don't have a car, perhaps they are in jail or they're homeless. Do you have that in the works already?
Do you want me to take that, Dr. Ghilarducci, or would you like to? Okay. Yeah, actually, we have a number of different, I guess, modalities for delivering vaccine. And so, and it takes a whole partnership. So while we do have mass vaccination clinics planned and what we call closed pods planned for certain discrete populations, we are also working to develop vaccination strike teams and also partnering with the state, asking for the possibility of statewide strike teams for certain populations. I know that the state is talking right now about how to do that strike team modality with the ag and farm worker community, but we also have, you know, many more populations that cannot get out. So just to give you an example of where and how we've distributed vaccine to date, it includes Dominican Hospital, Watsonville Community Hospital, Sutter, Santa Cruz Community Health Centers, WellPath, which is the entity that serves jail medical and jail health. So that's how we do the jail. Salud para la Gente, the Homeless Persons Healthcare Project. They're an important entity to help us reach homeless populations, as well as some of the county clinics. So as we move forward, the strike team modality distributed to whatever entity is available to accept vaccine is going to be part of our rollout. And we're relying on our South County partners. There is a group called the Pajaro Valley Community Group, and they meet weekly. There are over 50 members, and we're going to rely on them to help us as they have this entire time with outreaching to those discrete communities, particularly the indigenous communities.
Thank you. Our next question will come from Phil Gomez at KSBW.
This question is for Dr. Ghilarducci. As you're aware, Doctor, today they began vaccinating people who are 75 and older. How is it that they are able to get their vaccines, whereas the people who are 65 just got the okay from the governor to do so?
Yeah, thank you, Phil. The 75 plus age group has always been part of phase 1B. And so the direction we've gotten from the state is that when vaccine supplies are limited, we would prioritize the older individuals first since they're at higher risk.
Great, thank you. Our next question will come from Anna Maria at Kaiser Health News.
Hi, thanks for taking my question. My question's about the new infectious variant. I'm curious if it changes the public health strategy in any way other than asking people to sort of remain vigilant with the recommendations for hand washing and social distancing and masking. Thank you.
I'm happy to take that one. Yeah, so the B117 is very concerning. You know, the cases that have been detected in the United States have been amongst people who haven't traveled. So this is a clue that this is very communicable. Fortunately, it doesn't appear to be more, uh, uh, you know, dangerous in terms of if you get infected, you're not more likely to get sick than if you were infected with the original strains. But it will cause more cases and it will cause more deaths because it's so transmissible. What we don't know right now, and there's an effort in place with UC Santa Cruz to do some genomic sequencing to search for these variants. But what we don't know right now is whether we need to modify all of the safety messages that we've been putting out that, you know, maybe we recommend different distancing, maybe 6 feet becomes 10 feet. Maybe we recommend different kinds of masks or other kinds of what we call non-pharmaceutical interventions. But nobody really knows at this point. And so there is an effort locally here to try to find out if these variants are actually in our community. We don't know yet. We haven't gotten the results back yet, but we have a surveillance plan in place for that. And then what we learn from that may actually inform new recommendations, but you know, much more to come on that.
In addition, the state is doing a statewide wastewater surveillance program for the B117 and other variants. So we'll have a better idea as a state how much and where those variants are spreading. And of course, we'll be watching very carefully in terms of vaccine efficacy for all of those variants as well. So far, the news seems to be good that the vaccine will be efficacious, will work for all of those various strains.
Thank you. And now we'll go back to Kara from Santa Cruz Local.
Hi, how has the strategy for treatment changed now that we have little to no remaining ICU beds? Have we been sending many patients out of county, and are people in our local ICUs getting antiviral treatment?
I can take that if that's okay. All right. Yeah, the capacity to transfer patients like we would in normal times has been very limited because ICU beds are really constrained everywhere. That's what makes this a statewide, even nationwide emergency. The treatment has not really changed at this point. Typically, the antiviral medicines like remdesivir are given earlier in the course of illness. By the time they get to the ICU, it's not shown to be very effective. There also are some monoclonal antibodies that are out there, and those also are best given to people early in the course of illness. So when it comes time to going into the ICU, we're kind of left with some of the traditional methods of treating those patients, which is respiratory or ventilatory support, protecting their vital organs. It's a tough road. And when people end up in the ICU, this is one of the reasons we have a constraint. When they end up in the ICU, they tend to be there for quite a long time, much longer than we would see for typical ICU patients. So that adds more pressure on ICU capacity. But at this point, there has not been any change or I think part of your question was referring to crisis standards of care. And we have not had to go to that phase. I'm hoping that we don't. We were very worried about it about a week ago, but I think it really depends on what happens in the next couple of weeks.
Great, thank you. And we'll go to Mallory again. Mallory, go ahead and ask your question.
Hi, I just wanted to confirm a few things about the sort of division between the county and the MCEs. So the about 16,000 that the county has gotten today, that is, I believe, separate from everything that the multi-county entities have gotten, if someone could just confirm that. And then with regards to the big drive-through vaccination clinic that Sutter is sort of facilitating today, who exactly is like in charge and running that? And is that vaccine allotment coming from the county's allotment or Sutter's? And then finally, just on that lane, do you have any numbers or ballpark at all on how many vaccines the healthcare providers have received or administered?
Who should take that?
I mean, I can start taking it. I'm trying to track, there are a lot of questions in that question. In terms of, I think one of the questions was for the drive-through that's happening in Sutter, who's the lead on that and where's the vaccine coming from? And so it's important to understand that locally in Santa Cruz County, even though there are these the four legs of the stool in how we receive that vaccine, we've kind of been going, first of all, let me confirm, the 16,725 is the county local health jurisdiction allocation. My colleagues can correct me if I'm wrong, but those are what we have physically received as a local health jurisdiction. So what we do is we have been sharing vaccines. So to give you an example, we got our allocations far before the MCEs. So in the early days, the first week or two of the shipment, we were loaning our vaccine over to the MCEs. My understanding with the drive-through flu clinic at the flea market, that's Sutter's taking the lead. I really, really have to give a big shout out to our local Sutter chief, I believe his title is Chief Operating Officer, Stephen Gray. I mean, he really, week before last, took it on to consult his leadership at the regional level and to get approval from them as well as their legal counsel so that we could use the space and everything. But they're really leading that effort, and we're providing the support services, some logistical support. We're providing who is in 1A to go there. And my understanding is that it's a sharing of vaccine. So Sutter has gotten approval to do everyone in phase 1A, whether they're Sutter people or not Sutter people, Sutter patients or not Sutter patients. But then they're also going to do, when available, phase 1B with just their Sutter vaccine. So when they are able to do the phase 1A everyone, we're all kind of pitching in. Some of it may be Sutter vaccine from the MCE, some of it may be ours. But what we're trying to do locally is just trying to get it done and not worrying about whose vaccine is whose. But we are keeping track so that we can make sure that that allocations are distributed as equitably as possible.
I think Mallory was asking if our 16,000 number includes any of the allocation to the MCEs, and then whether we have numbers on how many those Sutter or other MCE distribution sites have given out.
So my understanding is they have their own allocation outside our 16,725. So if you go to the state websites, the state will tell you how much regionally was distributed by MCEs, but not specifically. And to my knowledge, we are not collecting at the local level. And we don't really have much insight into how much our MCEs have received, because remember, they also get these regionally, and then their organizations, as Gail likes to call them, the motherships, distribute them down to the local level. So it's really, really hard to drill down to what our local Sutter, our local Kaiser, and our local Dignity has for Santa Cruz County people.
Thank you. We'll go to Josh again.
I would just add that likewise, we don't have any information about allocations to the Federal Pharmacy Partnership nor through CalVax. So we only know about our own local health jurisdiction allocation, distribution, receipt, and redistribution.
Yeah,
And
so we're getting two.
Oh, go ahead, Dr. Guladucci.
Excuse me, I'm sorry. Yeah, we're getting 200 doses next week, which is the lowest we've ever been allocated. Now, that might be because there's other doses coming from other sources, but they're not telling us. So it's difficult for our planning perspective.
Yeah, and I was going to add that we've all been advocating to the state because they are the owners of the information across all legs of the stool, that perhaps it would be really, really helpful if they tracked that information in a statewide dashboard by county, because it's very difficult for us to do at the local level.
Thank you. Let's go to Josh from KION.
Sorry, I had to unmute it real quick. I had a few questions for Dr. Guladucci. I think a lot of people are wondering why it is taking so long to get more vaccine. Is it production or is it competition from other places? Also, who actually decides to how many, I guess, vaccines each county gets per week. I'm guessing it's the state, but like, what's the criteria for that? Since you're only getting 200, San Benito County is probably getting 400. And is it per week that they, allocate and send vaccines to counties?
Yeah. Let me take the last part first. So uh, we're looking at opening up a mass vaccination clinic, and we maybe want to get 500 people through there. And then we find out a week before we're getting 200 doses. So you can see what a problem that is for us in planning. The allocation is based at the state level, and they've done some, at least for phase 1A, some mathematics on how many licensed healthcare providers that they estimate to be in our county, and that's how the allocations were initially distributed. It gets more difficult as you get into phase 1B, because then you need to tease down how many people work in this sector and that sector, how many law enforcement, how many of other groups, and then suddenly now the 65 and over. The vaccine supply ultimately comes from the federal source, and so the production, I understand the production is improving, but the information I get basically through the news media is that the bolus of doses that are supposed to come our way were ones that had been held back for second dose, which was part of the original plan. Those are being released because there's greater confidence that the manufacturing can keep up and provide those second doses when needed. So we're going to see a one-time increase, I think, but ultimately the rate of vaccination in the public is going to be based on the rate of vaccine that is produced.
Thank you. We're going to return to Phil Gomez from KSBW.
Yeah, this is, I guess, open for either one of them. I know that any one of them. I know that we're going to need people to provide these vaccines. Is there anywhere where volunteers, what have you, and what's the background for them to perhaps sign up so they might be able to help with the vaccination process down the road?
Thank you, Phil. There's a website. On our website, there is a link for volunteer providers and another link for other volunteers. We want providers, potential vaccinators, to sign up through our Medical Reserve Corps, because that's the way that we can confirm that they have a valid license and are legally able to vaccinate in our community. And so we hope that folks will go to our website and sign up to be either vaccinators voluntarily or other volunteers. We need all different kinds of people with different kinds of skill sets to help in the future. So please do sign up.
Phil, I believe that link is in the FAQ. There's a question that says, how can I help, or something like that. They open that up. That's where the links live. Let's go to Tony Nunez from the Register Pajaronian.
Hi, thanks, Jason. I have a couple of questions about the stay-at-home order and the cases that we're seeing over here in Watsonville. So just overall, Dr. Newell and Mimi, how would the two of you grade the success that the stay-at-home order has had just overall since the regional order went into effect in, I believe it was in early December? And then there's been more than 6,200 cases reported over here in Watsonville. Do we have a better guess of the actual number of cases in South County? I know that might be an impossible question to answer. And with that prevalence of cases over here in Watsonville, and just hearing that phase 1A will most likely at the earliest get done by early February. What are the chances that, Watsonville sees some sort of herd immunity before we're ever done vaccinating the entire population over here? Thank you.
Well, of course, we all recognize that South County, Watsonville in particular, has been the hardest hit region of our community during this pandemic, and many of our resources have been focused in the Pajaro Valley and Watsonville. And we have tried to tailor our messaging, communication, public education to that community in particular in multiple languages. But we have seen a little bit more uniform spread of the disease in the past few weeks, less focused in Watsonville, less focused in the Latinx population, so affecting other parts of our community. A little glimmer of good news is that wastewater treatment facility data testing for COVID-19 shows in Watsonville a slight decrease in virus level. So we're hopeful that that might be showing that we may have peaked out in terms of new cases. I really hope that that is the case. That will bode well for our future. I know there was a first part of your question that I'm forgetting now.
Yeah, I think I can jump in and help. He asked first, there was an assessment of how the stay-at-home order is working or has worked overall.
Yes, so the state tells us that they do anonymous Bluetooth data to look at movement and travel. And they say that since the stay-at-home order has been put into place, that there's significantly less travel and movement of people in general. So we do think that it's had a significant impact. It's hard to tell though when it's holiday after holiday after holiday, or as the governor says, surge upon surge upon surge. So I think it would be worse if the stay-at-home order, I know it would be worse if the stay-at-home order were not in place.
Yeah, and
go ahead.
Oh, Jason, I was just going to add that one of the things that our epidemiologists follow is something called the effective reproductive number. And we can see that effective reproductive number when we start getting exponential spread and it starts increasing, and then a stay-at-home order happens, we can also see it come down. And I don't know if it's a result of the stay-at-home order, but it seems like it might be. And so we actually have some data, scientific data to support that.
And then if I can continue to follow through with Tony's questions, he asked about, there's a little over 6,000 cases in the Watsonville area. What is the likely number of total cases? Those are confirmed cases, right? Do we have an estimate on what the actual total number is? Is there a factor?
The CDC tells us that for every known case in the United States in general, we can assume that there are 7 other cases that are either not recognized or not tested.
Great.
Yeah, and the other piece of Tony's question was about herd immunity. And I do want to say that with so much transmission happening in South County, it would make me nervous for the community members to rely on herd immunity for overall immunity for the long-term future. You know, the best that we know right now about this novel disease is that if you become infected, that you might have some immunity for maybe 60 to 90 days. Much better to go ahead. If you have been infected, I know that our health officers are recommending that you still get a vaccine for that longer term, more robust protection.
Yeah, and if I could add on to that, great point. Herd immunity has always assumed the original COVID virus. And if this variant does become widespread, any estimates of what herd immunity might be are going to be much higher. And I'll just put in a plug on Tuesday, the 19th. If you go to santacruzworks.org, you can sign up for a webinar that's going to talk about UCSC's effort on genomic testing here in Santa Cruz County. And we'll have Dr. McEntee from Salud on there, as well as some scientists from UCSC. So that may be interesting to you.
Great, mark your calendars. We're gonna have another question here from Mallory. Go ahead, Mallory.
Hi, I wanted to follow up on what Dr. Newell mentioned about a state wastewater surveillance program for the new variant. Like when, does anyone know when to expect results from that, or where we can find out more? We haven't heard about that yet, and it sounds very interesting. Let's know when some results will be available.
I learned about it on a call with California Department of Public Health, just stating that it was underway and looking forward to the results. So the genomic testing happens at the VRDL lab in Richmond, California. And so I'm sure they'll be reporting out to the public in coming weeks.
Yeah, and I'll add there is a laboratory at UCSC that has been doing wastewater surveillance for us in Watsonville and elsewhere, and they are working on a probe to detect B117 and B134. So that is not in place yet, but we have some local efforts to look for that as well.
Thank you. I know we're going to start losing people here at 2, but we do have a couple more questions. We're going to go to Jessica. Go ahead, Jessica.
Hi, I just, it's my understanding that the state was urging vaccine distributors such as the county to begin dipping into their second shot reserves. I was wondering if yesterday's Washington Post article revealing that many of those Federal Reserve second shot supply had actually already been being distributed gives you any pause about using your own second shot reserves.
It does. We definitely want to act in the best scientific, evidence-based data mode. The state has helped us interpret federal guidelines or a federal push to distribute all of our second doses and has recommended that we only distribute 50%. So we will be following state guidance and releasing 50%. We really want to make sure that everyone gets their second dose. There's absolutely no evidence to support the notion of a single dose of these particular vaccines being sufficient.
Great, thank you. And Ian, I know Adriana was trying to raise her hand. It was up at one point. Ian, if you can unmute Adriana. And Adriana, if you're here, go ahead and ask your question.
Yes. Adriana Frederick Sutton, Univision. Thank you. You guys mentioned that you're working with Salud para la Gente for the vaccination process. Are there any plans for vaccination for farm workers specifically? That's one question. My other question, there is a community vaccine planning survey link. What is that for? Thank you very much.
I'll start with the survey link and just say that that's our way at the county level to keep track of organizations, businesses, even individuals who want to be placed on a list to ensure that they have a foot in the door for when their, especially their occupational category comes up, because we know that our medical providers can identify their patients by name, by age and by high-risk conditions. So it's easy for them to pull out, for example, 75 and up, or even high-risk conditions like diabetes. But it's much harder for them to pull out, for example, farm workers. So they don't keep that kind of occupational information in an easily retrieved data bank. So that is to help get people in line for when it's their turn to receive vaccine. And we have worked with an agricultural work group that is convened by our agriculture commissioner. And it includes members of the Farm Bureau, representatives of farm workers, various manufacturing and ag interests. And we've been doing that since the beginning of the pandemic. And we recently had a vaccine-focused meeting with them. And we're in the planning stages of special vaccination events for food workers. They are included in phase 1B. And that's everyone from the farm workers all the way to the bagger at the grocery store and everyone else in that food and agriculture line of frontline workers. And one thing is clear is that we will make it as open door as possible. So no wrong door for that occupational category. We will not be requiring any form of documentation. All they are required to do is give a name, a date of birth, and an address. It won't be cross-checked with any kind of identification. We will make it as accessible as possible. We're working with our farmers, our Farm Bureau to bring, to utilize buses and other methods of transportation for mass vaccination sites. and also recognizing that in some cases we will need to go to folks in the fields.
Thank you. Do we have time to pick up one more quick one from Mallory? Mallory, go ahead.
Okay. I was curious if anyone, to the county's knowledge in Santa Cruz County, has started receiving second doses from phase 1A, and if there's any specific numbers the county can provide on how many of the doses that they have, you know, in the freezer and stuff are being reserved for second doses, and how many are they trying to give out over the next week or so?
Yes, so both of our acute care hospitals, Watsonville and Dominican, started vaccinating their own staff, medical staff and employees on December 16th, and that was with Pfizer vaccine. So Pfizer vaccine requires a second dose at 21 days. And so indeed, many healthcare workers in the hospitals have gotten their second dose beginning last week already. So I do not know how many of our doses in our freezer are reserved for second dose, but we're keeping track of that and reserving 50% of them for second doses.
I believe it's about 5,000 out of that. Actually, more than that. It's more like 8,000 out of those 16,000 are reserved for second dose that are being shipped out right now.
Great. Thank you, everyone, for attending. We'll try to do these pretty regularly going forward. Have a great day, everyone. Happy weekend.
Thanks, everybody, for participating.
Thank you.